Pregnancy, while a joyous time in most women's lives, can also bring about drastic changes to our bodies, right down to our dental health. Anaida Deti from Dental X has some tips for ensuring that you keep your smile in tip-top shape for when baby arrives. Welcome to the show, Anaida.
Thank you for having me.
So the last time you were on, we talked about hormones and how they affect women's dental health. I can't think of another time, perhaps maybe except menopause, where a woman would be more hormonal than during pregnancy. So let's talk about some of the unique things that come up as far as dental health when a woman is pregnant. And can we start with the morning sickness?
Of course. So being a mom is, like the most amazing thing, but it does come with, unfortunately, with some changes in our body and also in our dental health. So some of the things that definitely we notice is the morning sickness. And when like the women, they have morning sickness, the acid in the mouth is very high. So I usually say that after you have that morning sickness, just make sure that you rinse with water a little bit. Or if you can also brush, which is the best thing you can do. But just rinsing a little bit with water would be a good idea. Not such a good idea with rinsing with mouth rinses because they might have alcohol, which is not so good at that time when your mouth is acidic. But just with water, and then that will help and just bring that pH back to normal in our mouth.
All right, let's move on to pregnancy cravings because with my first daughter, I'm not going to lie, I ate poutine every single day for 9 months. I put on a huge amount of weight. For my second daughter, my craving was sweet tarts, which was loaded with sugar. So how do the pregnancy cravings and are there any affect our dental health and should we avoid any?
And that's the thing is the pregnancy on itself, it shouldn't make any difference on the dental health. It's actually the things that we do that change, our dental health. That's the thing. And one of them definitely is the cravings, which not just you, but I think most of women, 99% of the women, they do have cravings and mostly it's sweets. Even for myself, like I remember one time when I was pregnant with my son, I was driving to London with my husband, and I think I had like 6 chocolate bars, which if you give me now a little piece, I can't even finish. So it's very normal. Again, what can you do? You can't say a pregnant woman, don't eat, like things that you crave. But sometimes, like maybe just minimize them a little bit. Maybe have little pieces at a time, like little sweets as a treat, if you can. And then try to have, maybe brush right after, again, rinse with water a little bit, or probably have a piece of, like cheese just after you have the treats. Usually the cheese does help the dental health and it kind of neutralizes all the bad stuff that happens in the mouth. So we can say, stop completely, but just do little things, to help that after you have those cravings, which are quite normal.
During pregnancy, should you seek dental care more often, or is there some sort of frequency you should look at as you go through?
When we see a patient and we do ask, or most of the time they tell us, they say, "Oh, I'm pregnant," and we do see little changes. In itself, it's a myth that like things change in your mouth, but they do change because of the lifestyle, as we were saying just right before. And the most common thing we see is pregnancy gingivitis, which we see there is a little bit more bleeding in the gums. And then we say that it's a good idea to have a little bit appointment more often. Most likely it's going to be 3 months. And that happens right after you have the baby and also you are breastfeeding. It takes about a year after you finish breastfeeding, if you do, but that's usually after a year that your body comes back to normal. So after that period of time, you do have to see the dental professional a little bit more often, also for different things that might happen in the mouth, which one thing is also, it can happen, you can have tumors in your mouth, and they are very benign, absolutely nothing, they're not dangerous, they go, as soon as you have the baby, your mouth comes back to, it's like magic. And then I had a patient, I think I said the last time, and she had 6 kids. And I saw her during all that time, and every single time she had those tumors. And the first time she was very scared because she's like, what is this? But after, because she had 6 kids, it became so normal for her. And then it just disappeared right after she had the baby. So it's nothing dangerous. But definitely it's a good idea to see the dental professional more often to make sure that there is nothing bad happening in the mouth.
Okay. The last thing I want to ask, because this is, I think a lot of people would want to know about this, is are X-rays safe during pregnancy? I mean, what if you suspect there's a cavity? Can you have an X-ray?
What we usually say during the first trimester is not such a good idea to have X-rays. But if there is an emergency, we have to see pros and cons, right? So if there is an emergency, we definitely have to take an X-ray to make sure to see what's going on and if there is anything as emergency needed at that time. But the X-rays that we use right now, they are digital. They have very minimal radiation. So definitely they are very safe to be used. But if we can, we say, you know what, we'll just wait if it's not an emergency, and then we wait till you have the baby, or at least after you pass the first trimester, and then we can take the X-rays and we can take care of whatever needs to be taken care of at that time.
All right. Excellent. Anaida, thank you so much for joining me again today. Where can people find out more information? I know you're always sharing great stuff, especially on your social media. So where can people find out more?
So thank you very much for having me. It's always a pleasure. And people can find us on our social media, Facebook, DentalX, Instagram, dentalx.ca, or at Twitter at dentalxsmiles.ca. That they can also send us an email or they can call the office for sure. And we are going to be very happy to help them.
Wonderful. Thank you so much. Have a great day.
Thank you. Thank you, Candy.